Great, thank you very much. I created a digital story for my presentation, so for the next 4 minutes and 56 seconds, you just sit back and I'll let the story speak for itself. Dementia impacts the lives of individuals as well as families, caregivers, and healthcare providers. Unfortunately, acute care for people with dementia is not as good as it could be at Island Health. I worked on a pilot project to optimize acute care for patients with dementia at Nanaimo Regional General Hospital. I worked with the Department of Seniors and Spiritual Health at Island Health. Dementia is a term for chronic, progressive brain diseases that show symptoms of memory loss, behavioral changes, and cognitive problems. The most common form of dementia is Alzheimer's disease. The statistics for dementia are staggering. Current estimates suggest that between 60 and 70,000 British Columbians have dementia. This population is expected to double within the next 30 years. Older patients with dementia have longer hospital stays, are likely to be discharged to long-term care, and have higher rates of readmission. Lack of continuity of care, staff shortages, insufficient time to take proper patient history, and ineffective communication and lack of training present barriers to improving care. The physical environment also presents a challenge for patients with dementia. Emergency and acute care wards are noisy, busy places. The comparison of gentle, patient, routine, and consistent care for people with dementia with this fast-paced environment where patients are often relocated and do not receive restful sleep or adequate nutrition makes it challenging to implement improvements. The Nanaimo Dementia Care Project is one of 22 projects across Canada funded through the Canadian Foundation for Healthcare Improvement to partner with patients and families for quality improvement. This project aligns with the BC Ministry of Health's Primary Healthcare Charter, which reflects the growing prevalence and impact of chronic disease and places a strong emphasis on populations living with chronic disease and those at risk. The Charter recognizes patients and families as partners in their care and promises to redesign health services to align with the patient's journey through a patient-centered, integrated health system. The Dementia Care Project included Island Health managers, frontline staff, and a patient advisor. Island Health recognizes the importance of involving people in their own care. However, this is a fairly new approach for both healthcare providers, patients, and families. The project team conducted a survey with patients and families to collect feedback on their experience of care in the hospital. It was acknowledged that this was a limited tool for partnering with patients. Communication between hospital staff and families was cited by caregivers as one of the most important factors for improving care for patients. I learned about plan, do, study, act cycles, which were used to monitor the quality improvement initiatives that were implemented in this project. Through the project, I became passionate about health literacy and partnering with patients. I took the lead in creating plain language resources and educational materials for patients, families, and healthcare providers. As health and community service providers, we can improve care for people impacted by dementia by working in partnership with patients, families, caregivers, and other healthcare providers. I am grateful to Island Health and the Dementia Care Project team, as well as Lynn and Betty, for this incredible learning opportunity. Thank you.
Questions of Kix? Oh, come on, there must
I think
be
they're
one.
mesmerized by the scrolling credits that go on and on and on.
Questions, comments? I guess you nailed it. Oh, sorry. Yes,
Oh,
Michael,
I thought I was
please.
going to give it.
Thank you. So that was a great presentation. Thank you. It's a very complex set of issues, and it's one that bedevils the provider system. So I guess my question to you is, in the experience that you've gained in being involved with this project, what do you think is the most important issue that the system needs to address in improving quality of services for patients with dementia?
I think that the critical piece is partnering with patients and patient-centered care, so personalized care, especially in an acute care environment where things can move quite quickly. I think we do well in community settings of getting to know the person, not just the condition. And unfortunately, in acute care settings, often there's so much focus on a clinical illness focus without seeing the person. And so bringing that public health, those values of partnering and person-centered care, I think will make huge impacts in terms of how patients and families experience their care in acute care settings, and seeing dementia and people with dementia as people. I think we've gone a long way in terms of seeing the person first in other aspects, in other populations, but somehow with dementia, they have this double bind of having the prejudice or our condition responses towards aging, and then our condition response towards cognitive challenges and problems. So they have this double bind against them that doesn't see the person. We just see an old person, or we see somebody that can understand. We don't see the person. So that person-centered care, I think, is going to go a long way.
Thank you.
Thank you, Michael. Anybody else? No? Okay. Thank you, Kix. Great job.
Thank you.